In 2021, a young man named Derek, who had severe hemophilia and a history of mental health and substance use, hit rock bottom. And he did what we hope everyone will do. He wanted to turn his life around. And so he went to his hemophilia treatment center nurse and asked for help. She called all the substance use disorder treatment facilities in the area, and none of them would take a person with a bleeding disorder.
Welcome to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Today we are joined by Kate Bazinsky, public health professional, fierce advocate, mother of a child with severe hemophilia A, and chair of the Bleeding Disorders Substance Use and Mental Health Access Coalition, or BDSUMHAC for short. Today we're going to look at how stigma, misunderstanding, and system gaps can cost lives, and how this community is fighting back with advocacy, data, and heart. Welcome to the podcast, Kate.
Thank you, Kai. I'm excited to be on the show.
Well, it's wonderful to have you as always, and I'm really looking forward to you sharing your story around how you got to this place. And I guess let's just start there, your background in public health.
Sure. So I have a background in health policy and politics. I worked for a member of Congress for about a decade doing his health policy on Capitol Hill. I got my master's of public health at Johns Hopkins and then did primarily state-based healthcare consulting work until I had kids. And my son was born with severe hemophilia A.
Tell us about that experience, because I know that, being in public health and then having a child who's going to need support. Can you talk us about the emotions of that moment?
Well, I didn't know that I carried the gene for hemophilia. We had no family history. And so I was really shocked. Mm-hmm. I wasn't sure what it was going to mean for my family, and it was a really scary and overwhelming moment.
Did becoming a parent with someone with hemophilia change how you focus your advocacy? Because obviously you're already in public health, and now it's even more personal. So did it change kind of where you took your energies at that time?
Absolutely. I had not been working in the bleeding disorders community prior to his diagnosis. I had actually been lobbied by the bleeding disorders community when I was working on Capitol Hill many years prior, but I stepped into this role when I became part of the community. I joined the board of the New England Hemophilia Association. They're our local chapter in New England, and helped them with their strategic planning process. And I started doing some fundraising for the community as well, and became somewhat of the default advocacy person on the board because of my background.
Mm-hmm. So, and your background's incredible, right? And it's almost beautiful in a way that you have all this experience that you can lend directly to your family. Through your experience sitting on these boards, especially now, can you talk to us a little more about the experience required to help, right? Whether it's fundraising or sending letters or making calls. Just tell us more about how listeners out there can approach these organizations less cautiously, given no matter what their background could be.
I think the best advocates are those who have a story to tell, who have an experience that they can use to change policy, to change hearts and minds, and they're willing to be vulnerable and to share it.
Yeah.
And I think that you don't need to have any background or experience. It's really about your willingness to be authentic and to share what has happened to you.
Yeah. Yeah, that's so well said. And I think so important because it is those stories. We've interviewed a lot of public health officials and we hear it straight from them. It is that story that, somebody essentially barged into my office to tell me that got the needle to move in the right direction.
Also remembering that you're talking with people. I think that especially today and when so much of the debate happens in social media, it feels really removed from the humanity of folks.
Absolutely.
But when you have an opportunity to sit down and talk with someone human to human and say, this is what's happened to me, these are the consequences of the policy that you have supported or that's been enacted, those human stories can move people and make a difference.
Yeah. Yeah. So speaking of human stories, why don't you tell us about the call that kind of changed everything for you as it concerns the current work you do with BDSUMHAC?
Absolutely.
Mm-hmm.
So in 2021, a young man named Derek, who had severe hemophilia and a history of mental health and substance use, hit rock bottom. And he did what we hope everyone will do, which is ask for help. He wanted to turn his life around. And so he went to his hemophilia treatment center nurse and asked for help. And she called all the substance use disorder treatment facilities in the area, and none of them would take a person with a bleeding disorder, especially one who needed infusion medication. And without access to the treatment that he needed, Derek overdosed and he died. And so his hemophilia treatment center nurse, Jen Feldman, was shocked and didn't know exactly what to do. So she reached out to the New England Hemophilia Association, and I was sitting on the board at the time. And because I was the advocacy person, it kind of fell in my lap. And his story really affected me because, you know, being from a good Irish Catholic family, we have a lot of mental health and substance use issues in our family. Mm-hmm. And I want to make sure that if my son ever needs treatment, that he would have the same opportunity that anyone else would. And so it was really the sense of wanting to ensure that our community has that same ability to access care and that same opportunity for hope and recovery that everyone else does, that really drove me to this work.
So given the problem you saw, tell us a little bit about what you've uncovered and how are you taking it in a direction that can help members of this community get mental health and substance use help if needed.
Absolutely. The first thing, as a public health person, I wanted to look at the data.
Of course. Someone has to.
We wanted to understand whether Derek's story was just a tragic but one-off incident or whether it was indicative of a broader pattern. So we conducted a survey of all the hemophilia treatment centers nationwide and found that 83% of providers who had attempted to refer a person with a bleeding disorder to inpatient or residential mental health or substance use treatment received a denial.
Which is devastating. That's a devastating number.
It was really, I was floored when I saw the data. And it was true in states across the country for both adults and for kids.
So what do you think was at the core of that denial of service that everyone else was getting?
So we followed up with interviews with the providers, and we found that the number one reason was related to the infusion medication. The facilities were really concerned about the use of infusion meds.
Because of past drug use or because the clinician or the folks working there wouldn't know how to administer it?
I think it's a little bit of all the above. There's fear related to the use of infusion medications. They don't want needles in their facility.
Right.
They don't feel confident in giving the medication, or they're not sure their license will allow them to give this medication. They're not certain they want to have someone self-infusing in their facility. So there's a lot of concern related to the infusions. But we also saw that folks who don't use infusion medication, but simply carry the diagnosis of bleeding disorder, were also denied access. So there is fear and stigma related to an unfamiliar medical condition that sounds scary, that is preventing us from getting the access we need.
Just imagine if you were told you're too complicated to treat, not getting access to the same healthcare that everyone else does just because of stigma or a lack of understandings. I think more to the point of what your organization does of informing, gathering data, and getting people the help they need is just so important. I guess tell us a little bit about why this should matter to the hemophilia B community. And then, maybe from that, what's exciting, what's hopeful about the work that you've done over the years?
Absolutely. But I think I just want to follow up on one thing you said, because I think it's so important. And that is that when people are told they're too complicated, especially people who are struggling with substance use, And they have found the courage within them to ask for help.
Mm-hmm.
And then they're told no.
Right.
I have one member of our coalition who struggled with substance use, and he talks about those windows of opportunity. And he went to seeking treatment on a number of occasions. And every time they said no, the window of opportunity for recovery closed, and he went right back to using.
Right. Because it's not a linear journey.
It's not a linear journey. And so it is really devastating when people are denied access, and that might be the only chance they get.
Yeah. Right. And I guess, that you ended up answering the question in a way, like, why does this matter to the hemophilia community? Because there are so many of us out there who are affected by substance abuse and mental health, needs or disorders. Talk to us a little more about how, BDSUMHAC works with the coalition and, what's giving you hope right now with the work you do.
Absolutely. Our community really does need access to mental health and substance use treatment. As you know, people with chronic conditions, hemophilia B, and chronic conditions generally have higher rates of mental health issues. The data in our community shows that as well. There was one recent study of folks with von Willebrand's that found that 63% of folks with VWD reported significant symptoms of depression, and 58% with significant symptoms of anxiety. And when you have low VW factors, so you have a more severe condition, the rates of depression skyrocketed up to 86%. So it's just such a needy community. And on the side with substance use, our community really needs access because although we don't have that same level of data looking at substance use in our community, we need a little more research there. We know that our community has struggled with pain, that some studies have shown that as many as 2/3 of folks with severe hemophilia struggle with ongoing chronic pain. And many of them are prescribed opioids.
Right.
For pain.
Amidst the, opioid epidemic, which is its own conversation.
Absolutely.
Yeah. And I guess for this, admittedly, you're not a clinician, but there's a need that is real, and we're not going to give mental health or substance use advice by any means now, but just building those bridges between care teams and the professionals that will give you help. I think that's kind of where you live. So talk to us about that. And I guess, how does somebody ask for help given everything you've discovered?
Absolutely. The good news is that we know with the right advocacy and support, people can get access. So we've done a lot of work over the last 3 years in developing tools. We have changed some national regulations. We've gotten some new language into federal regs. We are doing a lot to make it easier for people to advocate for themselves in conjunction with their bleeding disorder treatment teams. We conducted a provider impact survey this spring, that looked at how the impact of our coalition on access over the past 3 years. And what we found was, in talking with the same HTC providers, that 86% of HTC providers are now able to get their folks access to treatment. That's not all the time. It's not to say that they don't get denials, but with the tools and scripts and advocacy that we have supported them in, they are able to get their people with bleeding disorders access to the treatment they need. So we know that access is possible, that a denial is not the end of the story. It's the beginning of advocacy.
Yeah. And does that start with your care team? Like the conversation?
Absolutely. We really recommend for everyone, because there are these unique barriers to access in the bleeding disorders community. It's really important for everyone to talk with their bleeding disorder treatment team early, often, and honestly about any mental health or substance use concerns they might have.
I think, can you go back to the honest? honesty piece. I think we all struggle being honest at the doctor, no matter what it is we're talking about. So talk about the importance of that.
I think it's so important. I was talking with a community member who was kind of joking about how, he knows how to take the screening tests so that his provider team won't ever ask him any follow-up questions.
Right.
So he knows how to pass it without actually having to have a real conversation about mental health or substance use. And sure, you can do that, but the problem is if you let these issues go, the concerns linger.
Right.
You may not be able to get access in the crisis.
Right.
When you really need it. And so I know it's really hard to have these vulnerable conversations with your treatment team. And there's concern about what will they think about me? They've known me forever. They understand. They've been talking with many community members about these issues, and they're not going to be surprised about anything that you have to say.
Right. Well, thank you so much for being here, and your mission, your energy, everything is just a beautiful kind of story about what advocacy can do to really move the needle in the best direction possible for this community.
We really appreciate you helping us raise awareness.
Of course.
You can find all of our resources online at BDSUMHAC.org. It is adding to the alphabet soup of healthcare jargon. So
of course.
You could put that in the show notes so people don't have to try to spell BDSUMHAC. The other thing that's really exciting is we're partnering with the National Bleeding Disorders Foundation, and they just hired a brand new senior director of patient access. Erin Blocker is working with us and the community to help people get access to inpatient residential mental health and substance use treatment facilities. So in addition to talking with your treatment team, we now have a new resource available to everyone in our community who can help navigate this process and facilitate access for you or for your loved ones.
All right. Well, thank you so much again for your time. And this has been Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Again, we will throw all these resources into the show notes for you. And don't forget, you can always reach out to your Hemophilia B organization, hemob.org. All kinds of great stuff on the website under education, resources, and events. So make sure you check that out. And thank you again for your time, Kate.
Thank you so much, Kai.
Of course. Until next time, everybody, take care. This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.